Welcome to Gray Maybe, a limited series podcast and social experiment based on the topic of abortion. My name is Jillian Schmitz. I'm a professional dancer, actor, teacher, author, artist, and cat lover. Through my own personal journey of recovery, I found that things aren't just black or white, or a simple yes or no. For me, in my recovery, there's been mostly gray area and a lot of maybes. In most of my stories, you can find the gray maybe. I'll be sharing my own process through personal stories, interviews, and hopefully stories of others in an effort to help lessen the stigma and shame of abortion. If you'd like me to read your story on this podcast, anonymous or otherwise, please email graymaybestories@gmail.com. graymaybestories@gmail.com. Before we get started, if you haven't already, please subscribe on whichever platform you're using to catch future episodes of Gray Maybe. A note before we begin. While the topic of abortion and my belief in it being easy and accessible to all people who can become pregnant is a comfortable topic for me, sharing my own personal stories is not. I have a justifiable amount of fear of possible hostility and violence, both in person and or online. I also anticipate the possibility of judgment ranging from my own family members to strangers, in addition to the potentiality of losing certain work opportunities for publicizing my own experiences. I'm telling my story through the lens of my own experience. The revelation of my process is mine to tell. If you disagree with me or my views or story, know that I'm not speaking on anything other than my own experiences and viewpoints. Take what you like and leave the rest. Any feelings my story activates in the listener is for the listener to process and recover from. Any criticism you have based on my experience and choices are yours, and they're not my burden to carry. Welcome back. If you've been tuning in each week, I can't thank you enough for continuing to support Gray Maybe as a listener and bearing witness to this social experiment. It's coming up on almost 5 weeks since I started this podcast. On October 10th, 2022, I shared my abortion story and opened the forum for other people who have had abortions to submit their stories to be read. In the almost 5 weeks, there has been only one story to share besides my own stories. When I decided to do this experiment, I thought there was the potential for some stories, and maybe even a lot of stories. But I couldn't eliminate the doubt I had that there would probably be few to no stories sent in. I really wanted to be wrong, but deep down, I knew this is exactly how it would go. I had this feeling based on my own resistance in telling my stories. I've been overwhelmed with how many people have told me how brave or courageous they thought what I was doing is. But I'll tell you honestly, it doesn't feel that way at first. Happiness feels happy, and sadness feels like sorrow. But bravery doesn't feel brave, and courage doesn't feel courageous. They feel like fear and terror. But something happens when you tell the truth. It becomes yours. The phrase, "the truth will set you free," has never before been more appropriate. I feel free. Apparently, this statement originates from John 8:32, where Jesus Christ addressed a group of Jews who believed in him. The English variant, "and ye shall know the truth, and the truth shall make you free." I might be the least religious person I know, so my alignment to this phrase feels ironic at best. I may not have more true stories to share, but I do have a weapon of truth for this week's episode. I have an OB-GYN with over 30 years of experience in the field. I felt pretty confident in my knowledge on the subjects I asked Dr. R about, but I ended up learning quite a bit, and my producer Roderick wanted me to make a note here explaining that I get very excitable in this conversation with Dr. R as I learn new things. Roderick is sensitive to the idea that someone could misinterpret my excitement of information with excitement about abortion. However, I ask anyone confused by my enthusiasm, what's wrong with being enthusiastic about abortion? What's wrong with being eager about factual information about women and pregnant people and their reproductive health? Okay, this is really, really exciting. I have a doctor on the show today, like a real doctor who deals with lady parts. Dr. R, Welcome to the Gray Maybe podcast.
Hi, thank you. I'm Dr. R. I'm a board certified OB-GYN. I've been doing this for close to 30 years.
Wow, 30 years. Okay, that's pretty incredible. Okay, so we
Well,
definitely
30
can
years since I started my residency. So it's,
okay.
it's just a nice big number I can use.
Excellent. And now I know of you. I don't know you. I know two things about you. I know that you're a lady, what I call a lady parts doctor, and I know that you're a mother. That's all I know about you. So I'm glad to have those credentials. I know, that's 30 years is a long time for
It
any
is.
career, specifically one dealing in a medical field. Okay, so we're gonna hop right into it. I have tons of questions for you. I have tons of questions because I want like real answers. Someone who's a specialist in this kind of stuff. Um, okay, jumping right off. What? Okay, I hear this term. I see this term a lot. What does non-viable mean?
So non-viable means a lot of different things. We use the term viable in two different ways. We use the term viable in meaning in early pregnancy to mean that there's cardiovascular activity and it looks like a pregnancy is progressing properly. We also use the term viable when we're talking about a fetus before it's born, whether that fetus could survive outside the womb or not. There is no hard and fast definition for viability on either end. We can see cardiovascular activity before 6 weeks. We like to see it by 6 weeks. We should see it by 6 weeks. And remember that when we talk about weeks, we talk about 6 weeks estimated gestational age, but 6 weeks is really 4 weeks of the pregnancy because we start counting 2 weeks before people get pregnant.
Wow.
And it's important to discuss these things because
Wait a minute.
when
Hold on.
polit-
Stop.
oh,
Pause. Pause. You start. Hold on. We start. Okay, I need you to say it again. Because this is I didn't know that. Okay. Hold up. So you start when do you start counting weeks of a pregnancy?
you start counting weeks from a pregnancy from the first day of the last normal period. So technically, when we say, if you
So
were to
like
say someone was 2 weeks,
an egg traveling down the fallopian tube. Ish.
you're
No?
not even there
Later.
yet. You're not even there yet.
Okay. Well, okay. So let's I don't know if we should go there now or not, but so if there's heartbeat laws, right? Heartbeat
Yes.
laws that are about when you can terminate a pregnancy,
Yes.
your ladies, your time clock starts before your egg is even dropped.
Basically, so when politicians are saying that someone is sick, there's a quote heartbeat, and we're going to get into that too. That there's cardiovascular activity at 6 weeks. Um, that's 6 weeks from someone's last normal period. They've actually only been pregnant. It's actually not even pregnant. They've only ovulated 2 weeks before that. That's the convention. So they haven't been pregnant very long.
Most certainly before someone would know they're pregnant, which is what a lot of people are saying. You hear
It's
that
it's many people. If you were trying to get pregnant and you had normal cycles, you would know. If you weren't trying to get pregnant, if your cycles are not regular, you wouldn't necessarily know anything yet.
both of the times I was pregnant and had abortions, I was right within the window of if I was in a heartbeat bill state, I would have either maybe just made the cutoff or I would not have.
Yeah, that's
And
very early.
yeah, it was like around 5 to 6 weeks. 5 to 6 weeks. And if I couldn't, with my second abortion, I was up against a time clock of my scheduling of when I could get in before I needed to go do all these things that would make it very difficult for me to have the procedure. And that was at 6 weeks. So it was it and that was when I had symptoms, but I was keen to those symptoms. Like, not everybody has massive symptoms. Not everybody is,
No. And not
it's
everybody has the insight, and then
right.
people are going to write them off.
Right, of
So all
course.
those early things.
Of
I,
course.
I mean, I once took care of somebody who delivered a full-term baby who was in her mid 40s, who had never been pregnant before, knew her symptoms, knew she had, all this gas, which she thought was gas, which was fetal movement,
Right.
knew she had an expanding belly and had actually been to physicians with these problems, none of whom expected that she was pregnant. So your mind can do a lot of things if you're
Wait a
not
minute,
thinking
no one
pregnancy.
gave her a pregnancy test at any point in time.
No, she was in her mid to late 40s, and it wasn't until she was in labor that it was
I
discovered.
wish anybody could see my face right now. I don't even have words. Like my whole face is in I'm sad for her. That was
Now, I
like
can tell that story and be anonymous, and because that story happens every day around the country.
oh, of course it does. That's not the first time I've heard that. I'm just so surprised that like I don't know. I don't know what I'm surprised about. I have a girlfriend I know who didn't know she was pregnant till like 6 or 7 months. And same deal. It was like, well, did no one give you a pregnancy test or what? I don't know. Okay, so that happens. So non-viable is can be a flexible term, but it's
Yes.
basically to kind of decipher if things are progressing along the
When it's used in early pregnancy, non-viable refers to a pregnancy that is not progressing normally. When we use it in the latter parts of pregnancy, viability of a fetus refers to a fetus that once it's a baby and can survive outside the womb. Doesn't mean necessarily mean that it can survive without help, because you can deliver a baby at 24 weeks
right,
or even 23 weeks that requires extreme intensive care.
right. But at a certain point, there's no amount of anything we have that could mimic the womb at a certain point, right?
Correct.
Yeah. Okay. So what would you say, and I don't expect you to have like a cited source of a percentage, but is it common to have abnormalities found either in early and late pregnancy? Like,
Early pregnancy, if you look at all pregnancies, including people who didn't know they were pregnant, it's about 25% will
wow.
end in miscarriage. So about 25% have some kind of an abnormality that does not allow the pregnancy to grow. Pregnancy is a really cool, amazing miracle if you look at it, right? You have an egg and a sperm, they meet, they form a zygote. That zygote then, that's one cell. It then divides into 2 cells, and then those cells all divide, and every time they divide, there's a chance for an error.
Mhm.
One error early on dooms that pregnancy.
Mm.
So, when you think about all the different cells that have to divide, the fact that we ever have babies that are
Right, that
perfectly normal is, like,
anybody is
amazing.
functional.
Yeah,
Okay, a 25% is fairly large. That's like 1 out of 4, right?
that's one of the 4. If you look at people who, know they're pregnant, the number is smaller. It's more like 10 to 15% of known pregnancies.
Okay.
It's just when we add in all the people who didn't know that they were pregnant, who, maybe their period was a day or 2 late, and they lost the pregnancy and they didn't know they were ever pregnant.
Okay. Oh, interesting. So women y'all could have been miscarried, you don't even know it. Okay.
Yep.
All right. So now this is a really hard question, but can you tell us what a stillbirth is in case anybody doesn't know what that is?
A stillbirth is when the baby is born without a heartbeat. So the baby is born dead. So it either passed away in the uterus, or on the way out.
And what do you know a statistic or like a any kind of a close like how common that is or uncommon that is?
It's not that common. It's not uncommon either. It's like 1 out of 150, 160, that range.
Okay.
And that's counting anybody from like 20 weeks or so on.
Okay.
Most
And
pregnancies are going to be lost before 20 weeks. The vast majority are lost before 12 weeks.
okay. So majority of pregnancies are going to go bad 12 weeks, then 20 weeks. Very few in the end
Yeah.
here. Now, I have heard of this happening, and I don't know if this is common or not of the realm of stillbirths. I've heard of a woman having a stillbirth, like before she births the baby, that the baby has passed away and she's not going into natural labor.
hmm
So, what what is what happens? What do they do?
So it depends on what her gestational age is. If it's someone who is like mid second trimester through third trimester, like we induce labor, just like anybody, who actually is going to deliver a live baby. If it's earlier, then there's a possibility if you have an experienced physician of having a surgical procedure. In the early 20 weeks, there's a few there are a few of us OB-GYNs out there who can still do those procedures.
Now, I feel like people think that those are abortions. Would you medically classify them as abortions, or is there a different term that like those types of procedures would be labeled under?
So abortion is a funny word, right?
Yeah.
Abortion means, in medically speaking, it means the end of a pregnancy.
Okay. The end
So
of a
you
abortion just means the end of a pregnancy.
right. So you can have a spontaneous abortion, which is like in the first trimester.
And what does that mean? Like
That's
I did like or
that's when you miscarry.
oh, so a miscarriage is also considered a spontaneous abortion.
A miscarriage is a spontaneous abortion.
If I ever miscarry, I'm going to label it a spontaneous abortion.
Mhm.
And I
You can
actually
have so there's all different words we use with that. There's threatened abortion. Someone who just has vaginal bleeding, cervix isn't open. That's a
right.
threatened abortion.
Okay.
Now, if you
That's a
mention
threat.
that in the lay press, people are going to think a threatened abortion is someone who's threatening to go to an abortion clinic, right?
Right. Okay. Well, listen, I do want to encourage women right now because miscarriage is super common. And it's
Yeah,
another thing that women don't talk about as much. However, there is way less shame surrounding miscarriage. I think there's
absolutely.
still a shame surrounding it. That's why we don't talk about it. But there's way less shame surrounding miscarriage. But I really, and I'm not trying to be crude or rude or provocative, maybe provocative, but I really encourage you, women, start calling your miscarriages spontaneous abortions. Like,
And
why
and
not?
that's when it's so we have spontaneous, we have threatened, we have inevitable.
And what's that? Oh, like
Inevitable, the cervix is open. And there could or there may or may not be cardiovascular activity.
so
But the
this
cervix is opening, there's bleeding,
right, so
you
you're
know what's
going
gonna
into
happen.
labor. Okay.
Yeah, yeah, so that's inevitable. And then complete just means everything has passed out. I think those are all the words. Incomplete means some of the products have come out.
Right. Like if you lose a placenta, it's over.
Right, you lose a
Game's over.
placenta or a lot of times the embryo isn't developing correctly. You may have something called a
Okay.
blighted ovum where like a fetal pole, no fetal part ever really developed, so it's kind of like a placenta and a bag.
Okay.
Um, you know, those kinds of things.
Okay. That is
So,
I
and it's interesting you bring up the shame.
yeah.
When I had my first miscarriage, my grandmother was still alive, and she called me and she told me she felt like she took blame for it because she had had something like 4 miscarriages herself. Well, how was I already 30 years old and didn't know that my grandmother ever had a miscarriage?
Mhm.
It was something that she was ashamed of.
Mhm. Yeah, I think there's some kind of I think that this default is like what did I do? I must have done something. I mean, I know that my default emotions are always guilt and shame for some reason.
And,
but
and I think everybody does that. They go, "Oh, I took this antibiotic, I
right,
took this, I did that."
yeah.
And we go back to what I said in the beginning about those cells, right? We start with one cell, it divides, and then we have hundreds of cells. Something, a mistake. It's so easy for it to happen.
And, like, we don't start blaming ourselves for, like, scalp psoriasis or some shit like that. And that is like an overgrowth of cells too on a certain level,
Right.
is it not?
Right.
Like, I'm not a doctor, but, it's interesting, right? I don't know. I don't know why that gets really complicated, but it does for people. But I am definitely if I ever have a miscarriage, I'm gonna call it a spontaneous abortion, and then I'm gonna
Because
say,
that's what it is.
a miscarriage, because I think that the word abortion is hard. The word abortion was really hard for me to say for a really long time. Even when I would go to the doctor and they'd be like, "Have you ever had any surgeries?" I'd be like, "I had one termination and one." And I
And
couldn't even say
and you know
abortion.
what? The medical term, termination of pregnancy,
Mhm.
that is also a correct term.
Right, and I felt better about that than saying abortion.
And that's because language matters and people have taken the word and made it mean something that it isn't.
That's a good point. Okay, so all the talk about miscarriage. Um, in some of these states, I'm a little concerned because there is this campaign to kind of criminalize abortion. And if someone had a miscarriage or someone had an abortion, how would you be able to tell the difference afterwards?
You can't.
So if someone's miscarrying and someone wanted to penalize them for some reason, maybe there's like some weird interpersonal relationship stuff going on. If like a man wanted to say, "Oh, she had an abortion and she's experiencing a miscarriage," how would they how would
It's a
she
real problem because if, let's say, you have what we call, I mentioned, threatened abortion, right? Or an incomplete or an inevitable abortion. You have one of those. We can give you misoprostol side attack. It's a medication. People have heard of it for ulcers, but it works to help expel the contents of the uterus.
now would
And it's
this
also used to do, what a voluntary termination of
right,
pregnancy.
so
It's
that
also
would
used
be
for abortion.
the abortion pill
Mhm.
that they would give you as one of the options if you wanted to have an abortion, but
Right. Well, so when they give you the abortion pill, they usually give you the 2 pills, right?
right.
They give you, um, RU-46, I guess it is, mifepristone and, misoprostol. So,
Fun
yeah, you can't tell.
fun fact, in the mid 90s when I was a high school student, I did a paper on RU 486, which was before it came to the US. It was only in Europe. And that's why I did a paper on it. And I was so jazzed about it, being like 16 and being like, this is amazing. And everyone being like, you're a baby killer. Or whatever that was, whatever the ideas were behind it, because it was the 90s and it was just as controversial, if not more. So I'm so glad you said RE486 because I remember doing a paper on that, and then we got we got it here so much later. But those medications are also given if someone is experiencing a miscarriage to help them move that
Yeah, well, the
along.
side attack is, yes.
Okay.
Yes. And, one of the medications that we haven't talked about ectopic pregnancies yet, but one of the medications that we use to treat ectopic pregnancy, the medication, methotrexate, is used for many other things, including chemotherapy. It's used to treat lupus. And I have heard stories of pharmacists not prescribing it because it's also used to end a pregnancy, an ectopic pregnancy, or a pregnancy of unknown location.
Okay, so there's a couple things I want to get into on that because I have gone to a pharmacist before and they would not sell me Plan B. And then another pharmacist had to step up and give it to me. Now, I was lucky that another pharmacist was working that night, right? Um, so I find it's like to me so insane that someone can have that much control over someone else's medical desires, or they're like, I don't know, but that's a
And
whole
Plan
other.
B doesn't cause a miscarriage.
No, and it is not an abortion pill.
Not anywhere near it.
Can you tell
The
me?
idea of Plan B is to delay ovulation.
Okay, so
So what's wrong with delaying ovulation? I mean, obviously Plan B can also work in other ways. It is a progestin-based medication. So the point of it is to delay ovulation so that you don't get pregnant
right.
if the sperm are still there. It might also interfere with the sperm and the egg meeting. It might also interfere with implantation, but those are lesser and those are more like possible. The point of Plan B is to delay ovulation so that the sperm has nothing to meet up with.
And
Period.
the other and basically what birth control is as far as the birth control pill is the same thing.
Correct.
Okay. So
Actually,
anybody
well, the birth control pill is to stop ovulation.
right.
The oral contraceptives.
Right.
That's what their point is. But
Right.
yeah,
So Plan B is closer to a birth control pill than it is
correct.
the abortion pill.
In fact, the ingredient in Plan B is one of the same ingredients that is in some of the oral contraceptives. Yeah.
Okay. That's good to know for people.
In fact, before Plan B was on the market, we would give people, we would tell
Just
them to take
uh,
multiple pills
like a
from a birth
huge
control pill
dose
pack.
of birth
Yeah,
control.
Yeah.
Not that anybody should be giving themselves like a don't go grab a birth control and take like 10 of them. Don't do something like
Right,
that.
because
Just
they
go
also
get
usually have estrogen in them,
Yeah,
and
yeah.
that you don't want too much of that either.
Yeah,
So
yeah. Just go get plan B. You can get it everywhere. So tell me then what an ectopic pregnancy is, because I thought that the only way to solve an ectopic pregnancy was surgery.
no, so an ectopic pregnancy is a pregnancy that is not in the correct location in the uterus. And I'm very specific with my language on that because there is a form of ectopic pregnancy that actually happens inside the uterus. When we talk about ectopic pregnancy, we're usually talking about a pregnancy that happens in the fallopian tube.
So this is like an egg and a sperm have met in the fallopian tube, not in the uterus.
Right.
So
Well, and that's
clearly,
where they normally meet. They normally meet in the tube
and
and
then
then
they
they travel
travel
down the
down.
tube.
Okay,
So
so
it
you can
yeah, so they go it didn't
imagine,
travel down, they got stuck.
right? So you can imagine like trying to grow, blow up a very large balloon in an open field versus blowing it up in a small closet.
Right.
Eventually,
Or actually blowing it up in something that expands because the
right.
uterus
What?
will
Okay,
expand and expand properly,
got
and
it.
it will expand almost infinitely, not
Yes.
quite. But the fallopian tube will only expand a little bit,
And then it'll burst.
and then it will burst, and then you can bleed to death.
Wonderful. Okay,
Yeah.
so so
So
ectopic
it's really
pregnancy.
important to identify ectopic pregnancies as soon as we can,
And now that you said
right?
that there's a type of ectopic pregnancy that can happen in the uterus.
Yes, there's something called a corneal ectopic. So the corner of the uterus is the cornua. So it's Cornua.
Okay,
And that part of the uterus, it's up by the tube. It doesn't stretch the same way.
got it.
So you can have a pregnancy that's actually in the uterus, and as it grows and it gets further along than in the tube because it has a bit more space,
Yeah.
that can also basically explode and the patient can bleed to death.
That does not sound
Scary
desirable.
stuff,
Yeah,
right?
it's super scary. I think every woman who might be listening right now is like gripping an ovary and being like, "Yeah, I could feel how that would feel." Um, okay, so and I, I've seen some really crazy stuff on the Twitter and things. People talk like, okay, this is to me, this is so mythical that I don't even want to say it, but I'm gonna say it. Um, I'll ask the question: are ectopic pregnancies ever viable?
Never.
So there's
Well, no,
no.
I'm gonna take that back
Okay,
because we used to hear about these horrible pregnancies, like back when I was a resident, 30 years ago, and it was my attendings who are now my age, who are the age I am now,
okay,
talking about stuff that happened 30, 50 years before then. So, an ectopic pregnancy very, very rarely would rupture through the tube and then implant on some random part of the body, and the pregnancy would continue and become an abdominal pregnancy. So, the pregnancy is not in the uterus. It's horrible. It's just a surgical disaster for the mom and the baby, who both of whom may not survive. Extremely rare. I have never come across one in my career. Only the stories that my older attendings who were like
right. Back in the
probably even older than I
day,
am. They were probably in their 60s,
right. So this is back in the day where you didn't have near as much equipment to tell how things are
Right.
going
Right. You
earlier.
didn't have the early ultrasounds. You
Right,
didn't have the quantitative beta HCG, the blood test
right. The
that you can
testing.
test the level of the pregnancy hormones in the body. You didn't have any of that. So it would very rarely happen. But maternal death, it's a significant thing. It's still a significant problem. And ectopic pregnancies are a significant cause of maternal death.
I'm still blown away that all of a sudden you could have an abdominal baby, not a uterus baby.
Well, like
And
I said, I've never seen it.
okay,
I have never seen it.
okay.
But
But as far as you know, when we're talking about ectopic pregnancies, like there isn't any ectopic pregnancy you've ever known to produce a baby that you could somehow be able to keep alive.
no, you can't. You cannot take. Um, we're basically talking about something that's embryo, early fetus.
Right.
You can't take that pregnancy. I've heard politicians come. I think it was some guy in Ohio coming up with the idea. Oh, you can just take it and put it in the uterus. It just doesn't work that way. It shows absolute ignorance over science and how pregnancy works, and the how how pregnancies actually implant, the way the arterioles work, all the little fine things.
Yeah,
It's not possible.
we're getting quite advanced, but not there yet, bro. Like,
I
we are
don't think
not
we'll
there.
ever
I don't
be
think so either.
there.
No, I don't think it's I don't think that's going to be. Well, I mean, technically we are kind of there, but in a completely different way. Like with IVF
Correct, with
and
IVF, but that
certain things, but
pregnancy wasn't growing anywhere
no.
in a tube.
No, exactly. That's not it's not a replantation. This isn't a plant that you're just going to replant somewhere.
Yes.
Not the same thing. Okay. Um this is very good information. Okay.
So it's really important when if anybody's at risk for ectopic pregnancy, I want to throw this out there.
Yes.
It's call it pregnancy of unknown location, right? Because in the
Okay.
beginning, you have a positive pregnancy test. Maybe the hormone's not high enough that we can see anything yet. So we don't know where it is,
Oh, interesting.
right?
Okay,
So
so you're looking around, you're like, you're reading pregnant. We know things are there, but we can't find it.
we don't see anything in the uterus. We don't see anything anywhere else. So maybe your hormone levels aren't high enough. Those early hormone levels, the beta HCG level, is supposed to double every 48 hours.
Hmm.
So we might follow the blood test till they get to a high enough number
Hmm.
that we should be able to see something.
Okay.
And let's say we get up there and we still not see anything. Might want to follow it a tiny bit longer
And then you're like,
because what if
Mayday.
it's twins? If it's a desired pregnancy? If it's not a desired pregnancy, then you might want to go ahead and treat it medically so that we never get to that surgical emergency where you have to go in and remove a tube or someone's at risk of their tube rupturing and dying.
And that's like, it's internal bleeding is what happens.
It's internal bleeding.
Yeah.
Mhm. And
Okay.
it doesn't have to be like a big I think the worst bleeding case I ever saw, the pregnancy had not actually ruptured through the tube. It was starting to, and there was a little teeny tiny artery, the smallest little artery that was just pumping out blood, but it was an artery. And she
Mm.
had so many liters in her belly. It, she literally would have died had she not been in the hospital at that moment.
Wow. Wow.
No
Okay.
question.
This brings me to another question that I have about it's along to me it's along the lines of internal bleeding. I mean, there's a lot of ways. I mean, not a lot of ways, but there is ectopic pregnancy. If it bursts, right, you're internally bleeding. In labor, women can bleed to death, right?
Yes.
I have a friend who, in both of her pregnancies, had she not been in a hospital and received blood, she would have died. Um, and that's just one that I know of. I'm sure there's another one, someone who maybe has traumatic trauma from that and doesn't want to talk about it, but that's not super uncommon. Like women used to die a lot during childbirth, and that
Yes.
has not changed. Our care has changed a little bit, but not as much that it is still a super dangerous thing. What is sepsis?
So sepsis is a bacterial infection that gets into the bloodstream, and then there is, basically, your whole body responds. There's, like, this large immunologic response.
And is sepsis dangerous?
Sepsis is deadly.
Okay. And can women get sepsis during pregnancy and or birth?
Yes,
And how does that happen?
good question. I wish I knew sometimes.
Okay, so sometimes we just don't know. All of a sudden someone's
We
gone
don't know,
septic.
right? I mean, the normal vaginal flora has a whole lot of bacteria. That's perfectly normal and not a problem. But if that bacteria gets into the uterus, if it gets into the bloodstream, then it can be a problem. Just like you have bacteria in your mouth, right? There's oral bacteria.
Hmm.
And that bacteria is perfectly fine, but that bacteria doesn't belong in your eye, it doesn't belong, in your bloodstream.
So could you get sepsis if you're experiencing a miscarriage?
Yes, yes. And that's another type of abortion we didn't mention, right? Another medical term, septic abortion.
So if you're either like could sepsis cause
It
an
can go
abortion?
either way. Sepsis can
Okay.
cause the abortion, or there can be an intrauterine infection, an infection in the uterus that causes the miscarriage or abortion, whatever term you want to use,
Hmm.
and then that can go into the bloodstream. And that, yeah, it can go either way.
And can you get sepsis from someone checking uterus or vaginal? See, I'm not even using the right
Probably
term.
not. We use
Probably not.
gloves,
Okay.
but the risk does increase in labor when the cervix is open and, the
Foreign
water's broken,
bodies.
right? The bag of water's open.
Right.
So, you might be pushing more bacteria up there. So
Right.
when their water's been broken for a long period of time, we will start antibiotics.
As a
We do check
precautionary.
every pregnant woman for, group B strep, which is one of the common causes of these issues and cause of disease and illness, severe illness in babies too. So everybody's checked for that so that if you're a carrier of group B strep, which once again is a normal everyday bacteria, but it's not normal in the uterus, it's not normal in the bloodstream, and it's not normal for babies.
Right.
Um,
Everybody's got to
that can
stay
kill
in their lane.
that can kill babies.
Oh, wow. Okay, so streptococcus is that bacteria, right?
Group B streptococcus. Yeah.
Okay, that can kill babies, and that's what everyone should be all these people who are afraid that people are killing babies, they should be looking at streptococcus because that kills babies.
Honestly, yes. Honestly, well, okay. Yeah.
Okay, but so everybody's got to stay in their lane as far as like the blood has to stay in its lanes, not outside of its lanes, or you bleed out. Streptococcus has to stay in the areas it needs to be in as a bacteria, and if it goes to other areas that it
Yes.
shouldn't, it's bad. So everything's got to be in harmony, and if anything
Yeah,
goes
and
out of
there's so many
harmony,
things we haven't talked about, but you're bringing up the point that pregnancy is a dangerous form of life, a dangerous state in life, right?
yeah.
It's more dangerous to be pregnant than it is to be not pregnant.
Oh, 100%. 100%. I don't know anybody who would actually be able to argue that. I mean, I don't know how you would argue that
Right.
it's
So
not.
if you're forcing people to be pregnant for any reason,
Right.
you're forcing them to take a risk with their
Their life.
life.
Yeah. And uh, just because I want to talk about a little bit more about sepsis, because clearly I'm obsessed about going septic. Because I've heard of this. Okay. So also, can you, I know one person who, while they were in labor, their water broke and the something about the color of the water breaking was like not good, which meant that the baby had a bowel movement in
Correct.
during labor.
So the baby had meconium, which is basically a bowel movement. So it's all the tissue and cells, the waste that builds up, but it's not like waste like we get from eating that goes in
Right.
through. It's just
Right.
like all the cells and things that are in the intestines. And if the baby's under some kind of stress during the pregnancy at the end or in labor or whatever, that will come out into the amniotic fluid. If it's thick, that can be a concern because the baby then can get that because it's swallowing the fluid while it's inside, and they can go into the lungs
Right, cuz the baby's
and cause
still,
problems.
you know, kind of like an underwater fish situation.
Exactly.
Okay.
Yeah.
And is that like sepsis as well, or
No,
that's different?
no,
That's a different thing.
different.
Okay.
Yeah.
See, I got to get all this stuff cleared up in my head. Okay. All right.
We're gonna send you to medical school and then
Right,
residency.
I only have like 20. Like, listen, I wrote these questions out. I thought I knew the answers. I've learned a lot more. Now I really can be a know-it-all. Um, I really am gonna have some great points at Christmas time. That's what this really boils down to is you're giving me all of my talking points that I'm gonna need. Okay, so I'm looking down my list here. Uh, what is a partial birth abortion? Like, I don't even know what that is. I hear that term
And
a
you know what?
lot.
The first time I heard that was I think I was in residency. So it was in the 90s the first time I heard that phrase. I didn't learn it in medical school, and I went to look it up in a book, in an OB-GYN textbook, a Bible of OB-GYN,
Right.
and it wasn't there. Of course you know why. It's because it's not a medical term.
So why are people saying that? Why are people so what do
I
they
think so. This is my guess, and I did have a professor when I was in residency who was big in Planned Parenthood, I think, and he would do what we call today complex family planning. He
Mhm.
would take care of patients who had more complex needs for termination of their pregnancies. So he told us about a situation where, like a historical situation. We're talking generations before. Let's say a baby had hydrocephalus, which
What the heck is
hydrocephalus
hydrocephalus?
so look at the roots of the words. Everything in medicine
Water,
that comes from
hydro,
Greek or
water.
Latin.
Okay.
Water and the head, right? So they had hydrocephalus, the skull can grow to 2 to 3 times normal size, maybe even more. I don't really know exactly how much. So there is all this extra spinal fluid in the skull, and it grows and grows and grows. It crushes the brain, so the brain doesn't really develop. So you have basically a fetus with a huge skull,
And
right?
no brain activity.
And no brain activity or minimal brain or brain damage. Now, today we have people born with hydrocephalus every day who live normal lives because we treat it and we know more about it. I'm talking before we had ultrasound, before we really
So you
were
can
able to
actually,
follow these things.
if you're looking at someone who's having a pregnancy and they see, and you can tell that this is having, that they're going down this road of this condition, you guys can actually treat it in utero.
So there are some people who can treat these things in utero, or they can deliver the baby before it gets too severe and then treat it surgically outside the uterus.
Because you've been paying
Um,
attention, you're looking,
right.
yeah,
Or it could be very severe early on, and the patient may say, "Hey,
I don't want to take the risk.
I'm not taking the risk to myself or or to this pregnancy."
But only if
So,
you're in a state that you would be allowed to do that.
correct.
Okay. Um, so,
Which
so
which before the recent years, that really could happen anywhere.
right, you
Any
could do
state,
that. You
people
could,
could do that.
you had the
Yeah,
right. Yeah, you had the
yeah.
right to at any point in
Before the
time.
last year.
Right. Recently, this has changed. Okay. And so what
Oh, so I
was,
wanna get back to what partial
yeah, way
partial
back in the
birth.
day,
So what he explained was this procedure, and it was the baby would deliver, like, let's say the feet, but the head would be stuck.
right, because
So
the
they
head
had
is
instruments.
massive.
Right, they would had instruments that they would use, so you would say, the baby, it's still connected to the mom, the placenta's still working, so the baby is partially born,
Okay.
body is outside, but the head won't come out, so they would use instruments to decompress the head so they could remove it from the mother.
And so this is something that happened way back in the day because pregnancies has gotten to a point where you didn't, it had gotten so far past being able to help this situation. And this is probably in a time, is it pre Roe v. Wade? Is it pre
Oh, I'm
1972?
sure it's pre-Roe v. Wade. Yeah.
So if anything,
And I think it's pre, obviously, the kind of ultrasounds we have today, we can look at the
right,
nasal bones, like those kinds of
right.
things, you
So
know?
the care was, there was no option of a safe and legal abortion to help that
Correct.
situation if it
Right,
was
so this
never
is a
going to be good.
historical old procedure, and I'm thinking that is maybe what people were talking about. There's
Right.
also a procedure called, you know, D&C, right? Dilation and curettage. There's dilation and evacuation. There also was a procedure, and I don't remember when it came about, called D&X,
Mhm.
dilation and extraction,
Mhm.
where they would dilate the cervix and use forceps. We say forceps a lot in medicine because that's what we call our instruments. It's more
Mhm.
like tongs. They would
Mhm.
use some kind of tong
You
type
use tongs
thing to go in,
sometimes to deliver babies too.
right? To well, those are
Yeah.
different kind of we use the word forceps for lots of things. We also use them for little tiny things to grab little tiny things. So
Those are called
just something that you can
tweezers. Hey, those are called tweezers.
yeah, they're forceps.
Oh, okay.
So
I'm gonna call my
so but you
tweezers
basically
forceps from now
they
on.
would so they would use instruments to sort of pull out the products of
Okay.
conception, the pregnancy, the
Okay.
fetus.
Okay.
And so that would be more advanced than, let's say, the kind that you would do with suction when you're trying to perform a pregnancy termination. So I think that D&X procedure is also something that when people talk about
They're
partial
trying to talk
birth
about that.
abortions, I think they might also be talking about that. I don't really know because
It doesn't exist in your
it's not a
medical
thing.
journal.
It's
So
not a thing.
you don't know anyone who's performed a partial birth abortion.
No.
You don't know any woman who's come in and said, "I would like a partial birth abortion."
No, I
You
don't
don't
really
you
even
don't
know
know
what it
any,
is.
you haven't heard in any of your colleagues of someone saying like, "Hey, I had to do a partial
No,
birth abortion."
even the folks in what we call today complex family planning, I don't think they even have something that they call that because
Okay.
it's not a medical procedure, it's not a medical term, it's something a layperson created to describe something, but I don't know what.
Okay. And can you tell us a little bit more about a DNC? I have had friends who have had spontaneous abortions, aka miscarriages, and they had to have a DNC. And from my understanding, what that was, and you will correct me or elaborate, is that her body was not expelling the embryo fetus. I don't know where she was in her pregnancy. It wasn't super late into the pregnancy. It was definitely first trimester, maybe second trimester at the absolute most. And she had to have a DNC because her body was not dispelling. And now, because that spontaneous abortion, aka miscarriage, had passed, there was no life. It's now dead material and it's sitting inside of her, and it could cause what?
Sepsis,
Okay, so not good. Not good.
right?
It could cause death. So what so a DNC is what
So a
would be one of
DNC, you can actually do a DNC on someone that's not pregnant. It means dilation and curettage.
okay.
So dilation refers to needing to open the cervix
Okay.
so that you can get instruments of some sort into the uterus.
Okay.
When it's in the first trimester of pregnancy or someone's not pregnant, we call it DNC.
Okay.
And it's D and, not DN.
You're
Sometimes I
right.
see
D
people write
and like the
DNC.
and sign.
Yeah,
The
yeah,
little
because it's dilation and
and
curettage.
AND. Yes. Okay. And so you've done that without it needing to be pregnancy. You do it with it being pregnancy.
You can do it with what we call a non-viable pregnancy, right? A
Right?
pregnancy that doesn't have any kind of cardiovascular activity or didn't develop normally. You can do it in a voluntary termination of pregnancy, someone who's, quote, coming for an abortion,
Okay.
an elective
An elective,
termination of
right.
pregnancy.
I
You
do
can do
not
it for
want to be
that.
pregnant.
Yeah.
Right. Okay. Because it's scary and deadly. Or whatever,
Yeah.
whatever your reasoning is. Um, okay, here's another term I'm hearing all over the place. What is a late term abortion?
That's a really good question. That's another term I had to look up,
Okay.
and I found nothing.
Okay. So wait. There's no.
Once again, I was in residency when people were throwing around these terms, in the 90s of late term abortion, partial birth abortion, all these things. And, you know, here I'd already been to medical school. I'd done my OB-GYN rotation. I'd done extra rotations in OB-GYN because I developed an interest in it as I went through medical school. And I was already in residency and I didn't know what that was because it's not a thing.
Okay. And why is it not a thing?
'Cause it isn't.
So
I don't
so
even know what they're talking about. What are they talking about when they say late term? Late term is a pregnancy that has gone beyond 40 weeks.
okay, which is 9 months or 9 to 10, almost 10 months.
Right, so it's a pregnancy that's gone beyond the due date. Really 41 weeks, really a week.
Okay.
We
And
It's really a full week.
and
That's late
for
term.
people who don't know, pregnancy is actually 10 months. It's not 9 months.
Right, because remember we're counting the pregnancy from before you were actually
Yeah.
even ovulated? Right.
So when people are like, "It's just 9 months," you're like, "Actually, it's 10." Actually. Yeah, so anyone who's had a baby knows that it's 10 months.
Right, your due date is 40 weeks.
Okay.
Anybody who goes over their due date today, we call that late term.
Okay, and so no one's coming in at the 11th hour or the 10th hour, I guess, the ninth hour and saying, "I would like to abort this pregnancy."
No, no. No one is doing that. No one
You
is.
don't know anyone who's come in at 9 months and said, I changed my mind."
Well, I mean, I have seen a patient, someone like a young teenager who was in the late 30 somethings, a pregnancy, who was running around trying to find a place to have a termination, not understanding that,
It's too
because
late.
they didn't understand that their baby was five, their fetus, because
Right.
it's not really born. But once this child was born, that this was a viable pregnancy. This was not a pregnancy that could be terminated.
So no one's going to allow you infanticide.
Correct.
And infanticide is killing a baby.
Correct.
Okay, so now if if someone was in their ninth month or even 10th month of a pregnancy and all of a sudden something went very wrong, like, whoops, we didn't figure out that this baby is now, or this fetus is not going to survive more
Right.
than
That
an
this baby
hour.
doesn't have kidneys, this baby doesn't have lungs that work, whatever. This baby doesn't have a full brain,
And if it's
like
born, it will
whatever.
just suffer, or it will live maybe an hour, you know,
A short period of time,
or your
if at
baby
all.
has passed away, like we talked about stillbirth,
Mhm.
or um, you may die in this situation because of something that has happened, something's changed. Is that what people might do you think that's what the
Maybe.
confusion
I
is?
think that is what people are saying, and, that's all I can maybe it's later term, maybe that's what maybe they're really missing an R.
Right.
Later a later trimester pregnancy, you
Right.
know? Um, so I'm gonna back up a bit to, voluntary terminations of pregnancy for
Mhm.
non-medical reasons or for any reason. Less than 1% of them are happening beyond 24 weeks. So what you're just asking about babies that could be viable with, if they're born at 24 or
Mhm.
26 or 28 weeks or whatever,
Mhm.
um, that, they with intensive care that they could survive if everything is normal, that's accounts for far less than 1%
Okay.
of all terminations. So, yes, people can, in certain states, terminate pregnancies in those situations. And the vast majority of them are simply going to be doing a delivery.
So
Their
people
labor is going to be induced.
so for people who might be uh running around talking about late term abortions, someone who's having, which isn't a medical term, a late term abortion is probably in one of the worst situations that they've ever found themselves.
Yes, they're probably in a horrible situation, losing a pregnancy that they may have desired. And even if they
Right.
didn't desire, they have become attached. If they didn't desire in the beginning, they become attached. This is a wanted pregnancy with a severe medical issue. And I think that when people are talking about these so-called late-term abortions, which are not a thing,
Right.
um, they're talking about these horrible situations.
And
And it's a sin. It's honestly a sin that people are talking about this as if it happens electively, as if
right.
it happens, "Oh, because I don't wanna be pregnant." No, it
Right. There's the
happens because there's a
flippant.
horrible, horrible medical situation going
Yes.
on.
It's this flippant idea of that this is now, oh, I forgot to take care of this, and
Yeah,
I'm running out of time. I've only got 4 weeks left. I just got to make this deadline. Uh that is what I've kind of focused in on, and I've gotten slightly um really obsessed, for lack of a better word, is this all encompassing idea that anything about pregnancy, abortion, spontaneous abortion, miscarriage, all of it is that there is nothing to me convenient or flippant or irresponsible about any of it, because I find it to be all so serious.
it is.
I don't, and I think women are serious. I don't think women. I can't get past this idea that women are just like, "Oh, whoopsie, whoops-a-daisy." Yeah, I
Well,
just
we're not addressing the religious aspect
right,
also,
right,
but what's so interesting to me is even the most fundamentalist, most devout people, sometimes when they're placed in these situations, um, all of a sudden, if this procedure is available to them, they take it. For instance, I remember a patient when I was in residency, we're talking 30 years ago, of course, who was diagnosed with a cancer. And she had several children,
mhm.
and she wanted to live for those children. And it was the type
And
of
she was
cancer that
pregnant,
she was pregnant and she needed treatment right away. And guess what?
and you can't do cancer treatment and have a baby at the
Well,
same time.
you
You
can,
can.
depending on the cancer,
Right,
depending on the
but you're
treatments.
dealing with
But this
massive
particular one
treatments.
was one that was going to cause severe issues for the pregnancy,
Right,
whether it be malformations, whether it would be cause the fetus to die, whatever it was. So she chose to end her pregnancy, and also being pregnant can also complicate those kinds of treatments and
right.
surgeries and other things that she would need, and she chose to terminate her pregnancy. And this was a very religious woman who was anti-abortion, was anti-choice, but
Mm.
yet was able to make, and I don't know if she continued to be. I just remember meeting her during my residency
Right.
training, and
Right.
I guarantee this happens every day around the world, honestly, that people who believe, in the sanctity of life, suddenly it's also their life and the life of their families that
Right.
are coming into play, appreciate and make that choice when they're faced with these dire circumstances.
Right. And I feel like if there was less stigma and shame around it, I don't know if people would feel that, and I don't know how to do that. It's a tall order and a giant wish that that could be, you know, somehow eradicated. But I wonder if, like shame and guilt, like it really festers in secrecy, and when people don't want to, you know, it's like they make allowances for themselves, but not for other people. It's like in
And they
this.
don't even make the allowances for themselves until they're in those shoes.
Right. So you
They don't
can't.
know how to put themselves in
Right.
someone else's shoes.
Right. And I think that is one of the biggest issues, right? Is having the empathy, not just understanding, but really the empathy of like what it would be like to be that person in that circumstance, which might be different circumstances than yours. And um yeah, that is I've heard of nurses holding women's hands while they're having um an abortion, and these people being highly religious and them looking at these nurses and saying you're going to go to hell for this. I've heard those stories. And it blows my mind because I'm just like, "Whoa, really?" Like these people I it blows my mind. Anyways, that's probably
It's a whole other ball game.
a whole
Yeah.
other ball game. I want to go back to, okay, so you talked about we talked about late term abortion. So, I'm just going to ask this question because I'm not making this stuff up, guys. I wish I had to make this up. This was something my family said the last time I saw them in regards to Roe v. Wade. People are killing babies. Do you, Dr. R, do you know anybody who's killing babies in your profession?
No, but I do know that these laws will kill women.
Oh, okay. So, you don't know anyone who is like, I am a pro abortion doctor and I'm killing babies.
I know people who do family planning who perform abortions, and not a single one of them is killing a baby. First of all, what's a baby?
Yes,
A
let's go.
baby
Okay, let's go.
is something. You're not a baby until you were born. You have to come out of the body and be
And breathe
living
air.
independently, right? No longer a parasite,
Right.
because pregnancy is kind of a parasitic thing. It's living off the mother.
Yes. And
Yeah.
the
So
baby's
no
it's
one's.
breathing underwater like a fish.
It's not. It's practicing breathing. It's not even breathing. It's getting its oxygen from the mother's
Okay.
bloodstream.
So once it comes out into the world via C-section, via birth canal, and
Right.
breathes, that they are like, this is now a baby.
Right. We use the term baby all the time to
Hmm.
refer to a fetus, but that's not the medical term. That's not the correct language.
Okay. And so a fetus is different than a baby.
A
And
fetus is inside the body, is
okay.
inside the mother.
Yeah, you're not going to deliver a fetus. You now
Right.
have a baby.
Once I delivered it, it's a baby.
It's a baby. And then when is a child? When is a baby a child? Do we have
When it grows up,
I was like, is there an age? Is it 2? Is it 3?
I,
What is it?
I don't know.
Because I
I
hear
don't
people
know.
say that too. You're
Right. They'll say
killing
child.
child. I'm like, no one's killing children. I mean,
I hope not.
if you're, there's a lot of ways that children are being killed, but it's not through
Right. We could talk about
abortion.
guns in schools, right?
Well,
Those people they're killing children.
don't get me started. That is how children have been dying. Um,
Yeah.
okay. So the Guttmacher Institute, I've said this stat in one of my other podcast episodes. The Guttmacher Institute reports that 1 in 4 women by the age of 45 has had an abortion. Do you think that's a fair statistic?
I've always heard 1 in 3 to 1 in 4, somewhere in that range.
Okay, so it's pretty. That's what you would say is that's a fair statistic.
I've heard that. I've heard those numbers before,
Okay. Um, in your
and
ex,
it's not uncommon.
okay, it's not uncommon. In your experience, do women typically use abortion as birth control?
No.
So you don't have women coming in and are like, uh, Whoops, I just don't do birth control. It's too much for me. I'd rather just get an
No,
abortion
I
every
mean,
time.
are there women who've had 6 terminations? You know, sure.
But are they like,
Are they using as birth control? Probably not.
right, it's not like,
It's much more complicated than that.
right,
Then we're getting into the whole thing about access, right?
that too, right,
Disparities in care, disparities, medical disparities that exist because of economic issues, access issues.
right, which could start to become an even bigger reality now with some of the things I'm hearing, some of the rumblings about banning birth control and stuff like that, which to me just I can't. Yeah, that gives me so much anxiety. Uh, I can't even begin to really entertain it, although we have to, unfortunately. Okay, so you're not seeing there isn't this like because this is part of this flippant attitude of convenience that I see a little bit of talking points is like some women use abortion as birth control, and I just don't know anyone like that, and I know a lot of women.
I don't either, and, as part of our residency training, had a termination clinic. I don't think I ever saw a woman, even somebody who had had several,
Hmm.
ever come in and be flippant about it. It was a difficult decision for every single person I ever met in that situation.
That's been my experience as well, although I don't deal with as many women in the medical field, but from just talking to women and not even getting really into it, it's like women getting pregnant when they don't want to be is a high it's a source of immense anxiety, you
Stress
know.
and fear.
Yes,
Yeah.
stress and fear, right? Like I don't there's not a lot of women I know that are not like very afraid of being pregnant if they don't want to be. So I can't imagine that there's just women like, I mean, I'll just do this thing. I'll just go through the drive-through, blah, 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 blah. Like it's just not that. Um, okay, so this is I don't know if you can choose not to answer this question or not, but I'm going to ask it. Do you think the recent reverse of Roe v. Wade and the trigger laws and bans that have gone into effect make it difficult for you to uphold your Hippocratic oath of being a doctor, which is first do no harm?
I think that these laws are going to kill women, and I think that in that way, it's causing harm to women.
And I know you can only kind of answer for yourself, but is there been buzz amongst the medical community and your peers that it's a source of stress that like my whole thing is to first do no harm. My whole thing is to help people.
It's to provide health care.
Yes.
It's to provide health care, and termination of pregnancy is health care for women. For whatever the reason it is, it's a
Hmm.
form of health care. So they're now restricting the practice of medicine, and it's gonna hurt people. It already is hurting people.
Yes. Well, we've already seen some of the stories, and as the longer things go on, the more those stories will be. I'm sure and I'm sure there's way more stories than we're ever going to hear about, right?
Absolutely.
Yeah, we're not hearing
Because
about
people
every
don't wanna
story.
hear you're not hearing a lot of stories because of fear, right? People are fear of being prosecuted.
Right.
And I'm talking about patients and physicians and nurses and everybody in the field alike.
Hmm. Yeah. Okay. That's the rumblings I'm hearing too, but I'm also, I have pretty strong views on where I feel on the whole subject. Okay, I have two more questions for you and then obviously anything else that you want to kind of go off on. This is kind of a big question. What do you think is needed to support women more in the medical field in general? And this can be like support female doctors. This could be women in general. This is a general question, non-reproductive health specific.
Gosh, I could go on forever on that one. So
You're like, I've had a running list here. Let
that's a
me pull up my
huge
diary.
open-ended that's a huge open-ended
Yeah, what do
question.
you think is needed to
You
support
know,
women more?
like
You're like medical studies.
right, right. Let's talk about vaccination, right? Vaccination and pregnancy. Women are for years weren't included in studies. Pregnant women are never included in studies. Big deal, right? When the COVID vaccine came out,
Mhm.
should pregnant women get it? Well, should pregnant, well, not, is it going to harm the baby?
Mhm.
And that's not understanding the medical science. That's not understanding um, what vaccination actually is. You need to know what's in the vaccine.
Mhm.
And, it was a big thing. But there were some very brave women who had no question, who were
Mhm.
pregnant.
Mhm.
I know several physicians who were in the earliest studies who stepped right up and said, "Hey, this is mRNA. I know that this is
So pregnant
mRNA doesn't."
doctors were among the
The
ones that you
earliest
knew
pregnant
that were
people
like,
to,
"Test
yep,
me. Let's do it."
test me. And those doctors were in some of those earliest studies that looked at pregnant women and looked at after delivery, that looked at the antibodies that were passed to the baby.
Mhm.
They looked at the antibody in the cord blood, they looked at the antibodies in the baby to
Mhm.
show that the babies actually got protection from getting that vaccine during pregnancy. No different than other vaccines that we encourage in pregnancy, like the
Right.
flu. The flu is deadly in pregnancy. We know COVID-19 is horribly deadly in pregnancy. Some of the worst things I've ever seen
I don't think people
were,
are talking enough about that either. But
yeah, were some of the worst outcomes I've ever seen were in were during the worst part of the pandemic, the
and
earlier parts of the pandemic.
we're still
And
finding out. Yeah.
even today, the people who get hospitalized in pregnancy for COVID are the unvaccinated or the undervaccinated.
And then wasn't there like a huge upshot in stillborns during when all of COVID was happening?
We're still seeing it.
Wow.
We're still seeing a small increase in miscarriages and, you know, a small increase in other pregnancy complications that we think may be due to COVID.
Okay. But
Yeah.
we
Or is
definitely
likely due to it.
we know that so many things are not tested on women in the medical field. There's not like so many things. They'll test it on men. They'll test it on. It's same thing with like honestly with cars. They don't test like just up until recently. Even a lot of car companies were not
Right.
testing crash test dummies that were like the weight and size of women.
Right. And I am probably child sized, honestly.
You're a pocket.
So
You're a little pocket woman.
so if I had like checked the boxes for
You should
car
have a
seat
car seat.
size,
You're not supposed to be
yeah,
in the
I should
front
be sitting in
driving.
the back in the car seat. Like,
I mean,
is
that's
an airbag
real.
really designed for me? It's all part of that we don't test on women. Women with heart attacks often written off,
Right.
right? We talk about I like disparities in medicine is one of my little pet peeves in life, whether it is for women, whether it is for women of color, um, doesn't matter. And that's just one of those things that women are written off. Their symptoms are not going to be exactly the same when they're having a heart attack. So
Yes.
we need equal value. We also need equal pay,
Hmm.
right? There's procedures that a gynecologist might do that are the same as what a urologist would do. A urologist is a male doctor. Is it not a male doctor? Is a doctor of the urogenital system, but they also take care of women too, right? So they do, yeah. Yep. Yes. So it's them. So but there are procedures that they may do on a man that similar procedure is reimbursed at a lower rate for women.
Okay.
Yeah, so that bias, that gender bias goes into everything. Goes into I'm going to one
Here
of
we
my pet
go.
topics, right? Ergonomics, right? Surgical equipment, surgical
Okay.
tables, OR
Right.
tables, whatever. They're designed with taller people with larger hands in mind.
I never even thought about that. I when I had my knee surgery, I had a female surgeon and I was so excited about it because I don't know a lot of female surgeons and I was so excited that I would get a female doctor who had done over 1,000 of these surgeries. So I was like very confident in her ability and I also just I had a sexism to the positive where I was like, "Ah, she's a woman. Her hands are going to be small. They're going to be, she's going to
Delicate, right?
delicate, right? She's like that gave me so much peace, right? That gave me so much like confidence going into it. But that makes sense, right? Like the actual tools you guys are using, if they're made for men, it'd be like if you're
Mhm.
using a right-handed something and you're left-handed, right? It's not the same. You
Right,
have
some
to acclimate
instruments are
yourself.
very large, yeah.
Wow. Okay, so just
So there's a
basically,
lot more we can do to support women in
yeah,
medicine
in
in every
medicine.
way.
Okay, and
It's a
then
huge, huge topic.
yeah, and I agree with you. What is needed? that you think to support women in more in the area of reproductive health? I know you might have kind of alluded to some of this throughout this whole conversation. Accessibility, economic equality or equity, is there anything more specific in that area you want to talk about?
I mean, obviously, just access.
Access.
Access is the biggest thing.
Yeah.
And access that can be economic access, that can be
Yes.
access by location.
Yeah.
Um,
And
that everybody should have access to the care they need.
that's an
Period.
important point because actually I remember there being an argument about healthcare in general, right? That the terms of words of saying um, accessible and available, right? Or something like that. They were playing with words and it was like, oh, everyone has access. And you're like, okay, well, that may or may not be true, right? Not everyone may have access to reproductive health care. But then, even if you have like access, like you can actually get there, you can find the place, you can get yourself there. Can you afford it?
Right.
Is it economically feasible?
Can you afford the childcare
Yes, all of the
to
things, all of the things
to
around
or
it.
the day off from work to
Right.
even just go for a checkup?
Right, because this isn't something, although it may be deemed elective, it is not something that isn't time sensitive. So it's not
Correct.
like, oh, I guess I'll just wait till I bank up my vacation days, if you even have those, to go get this, flippant abortion that everybody thinks is happening, apparently. So it's like there's a lot of different reasons why it would be inaccessible or economically, difficult for women. Um,
Correct.
okay. I think you've done a fairly good job of outlining that. So, Dr. R, is there anything else you want to add? Like anything that you're dying to kind of like spout off about, or anything you feel like I might have missed or you want to go back to?
Let me see. I took some notes.
Perfect.
I think I think we hit all these. Yeah, I think we hit everything.
We did. We got all my
I
questions
think we hit
answered.
everything on my list.
That's amazing. I cannot thank you enough for your expertise and your willingness to really kind of last minute come on and do this and be flexible. Um, I, I was pretty confident about my little list. I was like, I think I know all the answers to this, and I was on the right track. But I actually learned quite a bit of stuff, and I am now going to be calling any miscarriages spontaneous abortions. That's
That's what they are.
and that's of course what
That
I
is what
took.
they are.
Yes, and but I listen, if language is going to be so powerful that we silence ourselves because of words, or we don't want to say them, or we don't want to say them out loud, or we try to skirt around them, or certain words are triggering such great emotional outpour that it can change people's laws and opinions and emotions, then we need to destigmatize the words. So you start saying the words, and that is an actual scientific medical word. A spontaneous
True.
abortion is a
True.
miscarriage.
I thought of one other thing.
Yes.
One other thought. I'm trying to put it into words.
Take your time.
So you just learned a lot.
I did.
You're someone who already had a knowledge base,
Yes.
but yet you're not trying to make laws for other people.
No.
You're not trying to make these decisions. So I don't understand why people who are not in the exam room
Right.
with the patient and the physician are making decisions about what can or cannot happen in that room.
Yeah. I see a lot of jobs out in life. Like I'll see firemen doing firemen things, and I see doctors doing doctor things, and I never once have thought to go tell them how I think they should fight a fire.
Right. And you know what?
I don't take the hose and start
And
putting it
I
out
and
myself.
I don't walk into legislatures and write laws.
No. No.
So why are people who didn't even go to medical school,
Right.
didn't train in the
Who
field,
don't have a uterus. I'm just going to throw
who
that out there.
who may or may not have a uterus,
Right.
why are they trying to insert themselves into this conversation?
I do
I
think
don't understand.
it's bold and not in a great way. I think there's a lot of audacity there, especially I have a particular, it really rubs me the wrong way when, you know, someone who is able-bodied is trying to make up things for disabled people. It bothers me if men are making up things for women. It bothers me in these scenarios where it's like, this is not your reality. This is not your experience. This is not something you have actual experience day in and day out. And you can't really have anybody else's experience, right? So one size fit all kind of legislation is not going to be good for anyone ever. But it is especially offensive when someone who doesn't even have the parts that they're legislating are telling you about those parts and how
Or the
that's going to be.
education.
Well, big time.
They
I
don't
mean,
even have
I
the
don't even want to get
education.
into education, but you've never even had a period, and you're going to tell people, like how that's all going to go down. Yes. Well, again, Dr. R, I cannot thank you enough. I'm trying to figure out as the series goes on, like how I can have you on again if you ever would come on again. And I just so much gratitude, and I hope that a lot of people listen to this. And I really hope people who might be throwing around these words listen. I don't know if they will, but I think like if you have said some of these words, that you can't seem to find in the Bible of all gynecologic situations, um, I hope I hope those are the people that are listening, especially. And you know what? If that's not my crowd, because it most likely is not, I hope you take this information and use it, use it, use it, use it, say it, speak it, shout it, because this is real. This is expertise. This is science. This is fact. And we got a myth bust because it's not what it is. So thank you,
Oh,
thank you,
thank
thank
you.
you. I am so appreciative of Dr. R's expertise in the field and her service and willingness to talk with me and answer my questions. I have various resources linked in the show notes that Dr. R recommended. I hope you learned as much as I did in this episode and take with you more information to share with others when the topic of abortion and reproductive health comes up. I'm happy to do a follow-up interview, so if you have any questions for Dr. R, feel free to email them to graymaybesstories@gmail.com, graymaybesstories@gmail.com. With a day or so to go before this very critical election, I hope the next time you tune in, I have some hopeful news on keeping the course of reproductive freedom and personal autonomy for women and pregnant people. Remember, if one of us isn't free, none of us are free. Vote for choice advocates, because if you're female or can get pregnant, your life depends on it. If you made it this far, thank you so much for listening, and I hope you were able to find something relatable in today's episode. As I mentioned at the beginning of this podcast, this is also a social experiment to see if in telling my story and the stories of others, I can embolden listeners to share their stories. If you'd like me to read your abortion story, anonymous or otherwise, on this podcast, please email graymaybesstories@gmail.com, graymaybesstories@gmail.com. Reminder, there is a very important election coming up November 8th, 2022. Please have a voting plan, know the rules and regulations of your state, and vote like your freedom depends on it, because now, more than ever, it does. For more information on voting in your state, go to vote.org. Thank you to everyone who helped make this Gray Maybe podcast happen. Producer and editor Roderick Barge, cover photo by Jose Perez, music licensed by Pixabay, special counsel Jada Ellingham and Roderick Barge. Special shout out to supporter Patty Ulgain. If you'd like to support this podcast, please rate, share, comment, and subscribe. Until next time, bye for now.